Hi, my name is Louis Farquharson. I am pastor of a local church here in the city of Coventry. The past couple of years or so, I've been on this amazing roller coaster ride regarding cancer. It has not been a fun ride, but it has been a very interesting one. Um, 2 years ago, I was tested positive for early stage prostate cancer, and it was confirmed. And then last year, my brother, who was battling a very rare blood cancer, he passed away in hospital of that cancer. There were other complications as well, but cancer was the main factor. 3 months after that, my mom, she died of a lung cancer, and that was going on for approximately 2 years. But it just seemed as if everything was expedited between March and July of 2024. And during all of that time, I started battling my own personal journey with prostate cancer. To deal with prostate cancer whilst you're navigating the journey of two family member passing is not pleasant. It affects your mental health, it affects you emotionally, and it affects relationship with others. And those around me who were supporting me, they have been excellent, and I'm thankful that they have been there. However, with all of this, after my brother dying and my mom dying, I was able last day to actually have surgery for prostate cancer. Getting to that stage was not easy, it was not simple, because I had to almost push to get my blood test. At one stage, I was asked by the GP, why do you want to have a blood test? Now, I'm not quite sure if it's their way of actually saying, oh, you're having symptoms or whatever it is, but for the fact that you're at risk, and you're asking for a blood test, a PSA blood test, I think every GP should be more than willing to encourage their patients once they get to a certain age and they become at risk age to actually have this blood test, right? And so I would like to encourage every man out there, every man, to make sure that you insist on having your PSA blood test. Do not put it off and think, well, okay, I'm okay, because you don't always have symptoms. Some people never have symptoms until it maybe in the advanced stage. So I would like to encourage everybody, especially if you're a black man, 1 in 4 of us are likely to actually have prostate cancer. We're at risk from age 4 to 6. And so we're at risk. So therefore, you be proactive, you be intentional, go and push for it. Make sure your GP knows that you're actually demanding this. I need this to be done, because prostate cancer is now the number 1 killer where cancer and disease is concerned for men. And if that's the case, then every man out there, once you get to a certain age, you actually get into the firing line and you are likely to be exposed to prostate cancer. So please, be intentional. Do not put it off. Don't bury your head in the sand. Don't say, well, I'm okay, I'm fine. Don't allow anything to stop you from actually going and have a blood test. It's a blood test. That's all it is. It's a blood test. It's not open heart surgery. It's a blood test. It's not something that's going to put your life at risk. And I want to encourage also wives, sisters, mothers, daughters, when your fathers or your brothers or your sons get to an age where they're at risk, encourage them. encourage them, push them, nag them, annoy them to go and actually have the blood test. It's best to rule it out than to actually end up having to bury them, because prostate cancer kills, and you don't have to become the next victim. You can be the one that survive and have a survival story. Yeah? My brother died just after I was diagnosed. 3 months after that, my mom died. Some years prior to that, my uncle died of prostate cancer. And all three of them are cancer related. So my headspace was a mess. But I can talk about it. And here I am pleading and requesting and asking that men will rise up and take action to make sure that they have the blood test done. I hope this is helpful. I hope this helped you to make the right decisions, the right choices, and potentially save your life. God bless you.